are back with pharmacist Dr. Brittany Blake with Cone Health Community Pharmacy at Moses Cone, talking about what you need in your summer first aid kit. We were talking about all the things that you need to do for your first aid kit. Now we're going to kind of talk a little bit about prevention and what kinds of things should go in a summer injury illness prevention kit. Not just a first aid kit, but a prevention kit.
Yeah. So some things that we want to do, being preventative is probably going to have the biggest impact. So having sunscreen, making sure that your sunscreen doesn't expire, not using stuff from maybe previous seasons, some sunglasses and a hat for some additional sun protection, making sure we have insect repellent for those bug bites we were talking about, and also protective eyewear if you're going to be out doing yard work. Okay. Those simple things can really prevent a lot of the injuries that we see this time of year.
And anybody who has done yard work over the past couple of weeks, they know like the bushes are going everywhere and stuff's flying and whatever else, and there's been lots of close calls, so the eyewear is good. All right, so what are some commonly forgotten prevention items that maybe people don't think about them until they really need them?
Absolutely. I would say probably some of the most overlooked are just your everyday essentials. So having hand sanitizer when soap and water isn't available, having some bottled water on hand, making sure you're staying hydrated, some cooling towels or fans to try and prevent some heat-related illness, and then of course wearing protective gear and helmets if you're going to be doing biking or riding scooters, things like that. And those are some of the things I think people don't always think about.
Okay, we talked about restocking the first aid kit. Now we kind of want to maybe talk about restocking our own medicine cabinet and cleaning out the medicine cabinet. How often should we do that? This is going to be like a 5-part question. How often should we do that? What are the biggest do's and don'ts of doing that?
Yeah. I mean, I would say, again, at least twice a year is probably a good time to revisit what is in the medicine cabinet, making sure you're getting rid of things that you're no longer taking or also things that have expired. So some of the big do's, you want to make sure that you take it to a drug take-back program. Lots of pharmacies in the area, including all the Cone Health community pharmacies, do have drug disposals where you can bring in medication. Also, some law enforcement offices do as well. Some of the big don'ts: don't flush your medication unless it says specifically on the label, and don't leave those expired medications around so that you potentially take something that's out of date. And then if you can't access one of those take back sites, we recommend mixing it with something like, with the medication with something like coffee grounds or something like that, putting it in a sealed bag, and then you can put it in your regular trash if you're unable to access one of those locations.
Gotcha. Okay, so beyond the kits, staying up to date on vaccines is also one of the keys for prevention as well. We don't normally think of vaccines in the summertime, right? We think about them during like flu time.
Oh, absolutely. But vaccines are such an important part of staying healthy, especially as we have a lot more contact with folks, whether it be through international travel, kids going to camps and that kind of thing. So making sure you're up to date. I always think about tetanus shots this time of year, making sure you've had your seasonal COVID shot as well. And then use your community pharmacist as a resource for screening. We're able to look and see what you have had and what you may potentially have a gap in. So that way you're fully vaccinated and protected ahead of the summer.
Well, speaking of use your local pharmacist, so I had that thing where I had that wasp bite and I already take an antihistamine for regular seasonal allergies. And then I thought to myself, I'd really like to take a Benadryl, but is it safe to do that, to mix that? So I think to myself, why didn't I pick up the phone and talk to the pharmacist? Is that something that is a normal, common practice?
Oh, absolutely. Pharmacists are known as being the most accessible healthcare provider for that reason. We're typically just a phone call or a walk up to a pharmacy counter away. So definitely lean on your community pharmacist if you have those questions or if you're uncertain. There's never a dumb question. You definitely want to make sure that you use us as a resource. We're happy to do that.
I mean, you can go online, but sometimes online leads you astray.
Oh, absolutely.
Okay, so call your local pharmacist and ask them the question just so that you know that you're okay. Any other special items recommended for people with like allergies, asthma, or diabetes that we should be thinking about?
Yeah, just making sure that you have a plan. When I think about diabetes, if you have a medication that requires refrigeration, making sure that you have a cooler or something like that. It can get really hot inside of cars this time of year. And also making sure that you have your medication close by, so that way you're not having to, in the case of an emergency, search around and try and find it.
Right, don't be on a hike and have your insulin pen back in the car when you needed to take your meds, right? Okay. Any final thoughts on stocking up on summer first aid kits and things of that nature?
I think the biggest advice I have is making sure that you are preventative now and proactive. So you're not waiting until something happens. Taking a little time to go ahead and build or refresh the kit that you have is an easy way to make sure that you're avoiding the stress down the road. So making spend less time worrying about you're having all the right things and more time just enjoying a safe, healthy summer.
Yep, that's what we all want. Dr. Blake, we appreciate your time and your expertise. If you missed any of this, you maybe want to send it to someone. This is going to be in the To Your Well-Being section of our website.